The effect of the Affordable Care Act on emergency medicine. An emergency room is something many people only see on their worst days. It is staffed with smart, calm, quick-thinking adrenaline junkies. The staff in the emergency room is often the first in line to respond, assess, and intervene in emergency situations. Emergency responders have existed since the beginning of time, just not always in a formal setting. The emergency room is the only medical setting that is a guaranteed access to health care. The Federal Emergency Medical Treatment and Active Labor Act, also known as EMTALA, was established in 1986. It mandates that a patient can receive medical treatment despite ability to pay. Unfortunately, not all patients seen in the emergency room are seen for emergencies. In March of 2010, President Obama signed into law the Patient Protection and Affordable Care Act. The Affordable Care Act was created to increase access to health insurance, including expanding Medicaid eligibility, subsidizing health insurance premiums, and providing incentives for businesses to provide health care benefits. It has been estimated that the Affordable Care Act will allow approximately 32 million U.S. citizens and legal residents to have insurance for the first time. Despite the increased availability to health insurance, there has not been sufficient enough increase in primary care providers to meet the demand. Also, many primary care providers do not accept Medicaid due to the low reimbursement amounts. These issues have led to emergency room crowding. According to a recent poll by the American College of Emergency Physicians of 2,099 emergency room physicians, more than one quarter report significant increases in emergency patients. According to a local rural emergency room physician called HB, the Affordable Care Act has had an effect on patient loads. He states, "We are some patients' only means to health care even if they have newly acquired insurance. This means that I, as well as my nurses, are often overwhelmed by patient loads. It becomes very dangerous when you are distracted by low-level patients and cannot focus on your truly sick ones. There must be progress made to increase private care providers to try and cut down on this problem." Emergency room crowding is dangerous for all patients. If a nurse cannot give the attention needed to truly sick patients because she is handling non-emergent patients, mistakes can be made. Also, when a triage nurse is faced with a high patient load, the triaging process may not be accurate. Because of the Affordable Care Act, a significant number of Americans now have access to health care. This has been instrumental in many people finally receiving the health care they have needed for a long time. Unfortunately, the surplus of insured patients has not been met by a surplus of primary care providers to handle the increased number of patients. This leads to emergency room crowding and ultimately causes healthcare fatigue, understaffed facilities, and safety issues. Until the supply of primary care providers is increased to meet the demand of the patient loads, emergency rooms will continue to be the first line of defense for non-emergent cases as well as the true emergencies.